Welcome back to a special episode of Coffee Walk MD. I'm Dr. Brian Kendall.
And I'm Dr. Brittany Makehead.
And instead of this time being a cure for your boring conversation, it's now a cure for your bad colonoscopy prep.
Bad colonoscopy prep.
Yes. And
Is there a good colonoscopy prep?
I mean, technically, no.
There is. We're going to tell you about it.
I mean, as you will learn about me.
Tolerable.
Tolerable, yes.
There is a tolerable colonoscopy prep.
Tolerable. So
and we're here to tell you about it.
We're here to tell you all about it. So make sure this episode we are making so that it can be shared everywhere because we have both had colonoscopies.
Been there.
We have lived through it. We are both physicians and we know how to make this tolerable to where it'll just be, you can just do it and get it over with and move on with your life.
Yeah, and really the reason we came up with the idea for this podcast, and we'll get into it here in a second, but Brian is kind of a big baby.
I am a big baby.
Especially when it comes to this stuff. I had gone through 2 colonoscopies in my short lifetime already, and I was like, bro, do not worry about it. It's going to be fine. He's like, it's not fine.
No, it wasn't fine.
It's not fine.
Yeah.
And then I showed him the tips that we're going to tell you about. And he was like, oh, well, that's okay, actually.
It actually was a not bad experience.
Yeah.
I wouldn't say it was an amazing experience.
But it went from being absolutely
fine.
Insufferable to, okay, this is fine.
Yes.
So if I can help him do that, we can definitely help you take it from insufferable to tolerable.
And how much more tolerable can you make it than talking about it on a coffee walk? So,
cheers to that.
Here we go. So, as we always start off with, we are drinking this morning Foresight Coffee, another local Charleston coffee, not affiliated. You love to say that. We're not sponsored, although we don't mind being sponsored.
We're open to it.
We're open to it. And then I picked out our mugs especially for this episode.
Yes.
Yes.
Okay, so if you're listening, we're sorry. But if you're on YouTube, you can see.
Yes.
So Brian's mug.
My mug is the dumpster fire meme that is very popular with the dog with the little hat in the middle of the fire. He's saying, this is fine.
This is fine.
As you were saying that, it's like, that's exactly my colonoscopy prep the entire time. I was thinking, this is fine.
This is fine.
It's fine. Yes.
Yeah. And mine is very affectionately got propofol
because this is the wonder drug. When you go do your colonoscopy, you don't remember anything. It makes it complete. I don't remember anything about my colonoscopy.
Well, here's the deal: not every colonoscopy is done with propofol. Did you know that?
I did know that.
But we do love a colonoscopy with propofol.
Yeah, for sure.
Okay. We're not going to get into all the nitty-gritty of colonoscopies, colon cancers, all of those things. We are going to remind you a little bit about why it is important.
Mm-hmm. So a quick, important reminder about why it's important and who should get one. So who should get colonoscopies? The powers that be say that if you are 45 or older, you should have a screening colonoscopy. Doesn't matter who you are, where you're from. Everybody at the age of 45 or older should have a screening colonoscopy. If you have a primary family member, a brother, a sister, a mom, or a dad who was diagnosed with significant polyps or colon cancer at whatever age, then you should get a colonoscopy 10 years prior to their diagnosis.
Correct.
So if they got their colonoscopy at the age of 50, then you should be getting a colonoscopy at the age of 40. And
not if they got it. If they had one and a polyp was found.
Exactly.
At that age, then you need to go 10 years
prior to that.
Again, please visit your GI, your primary care doctor. They'll be able to help guide you on all of these things. But that's why it's important. The other thing that I wanted to really quickly talk about in terms of scheduling your colonoscopy, and I think people forget this, like with the dentist appointment, with the doctor appointment, with surgery, it's like, okay, my procedure is on the 5th, and that's all you have in your mind in terms of work and childcare and all those things. But with a colonoscopy, do not forget, you need the day prior as well in order to do a sufficient prep. And this colonoscopy does not happen without a sufficient prep. We're going to talk about that. So whenever you're scheduling this, when you're putting it on your calendar, be sure to grab that date, but then also work backwards and think you're going to have to get childcare and take off work and all those things the day prior as well.
Yep.
Yeah.
All right. Well, let's get into this. Top 6 tips for making your Prep, less sucky.
That was really painful.
It was
to watch
really
you
painful.
Get through that.
Well, I wanted because I really wanted to say less crappy, but I mean, it was. I guess I can't.
You wanted to say something else.
Yeah, that's true too. Yeah.
Okay, so the very first tip number 1, follow the instructions completely. And this seems silly, and you're gonna hit like pause, and you're gonna never come here again. But hear me out. They will cancel your colonoscopy, no matter how crappy it was for you. They will cancel it if you have not done a sufficient prep.
Yes.
And that means everything should be coming out clear as day.
Yes.
Right?
Oh yeah.
It should
Poop
look
and
like
water.
it should look like pee.
Yeah. Well, no, it should look better than pee.
It should look like water.
Water.
It should look like pee turning into water. It's going to. We'll get into this. It should feel like you're peeing out your butthole.
But it doesn't hurt.
No.
And it's not.
It doesn't hurt.
It's not uncomfortable. It's
No.
a weird sensation.
It's an odd sensation.
Yeah.
And we'll get into that at the end.
Yeah.
That's part of tip number 6. But tip
Yeah.
number 1 is complete your prep entirely. Follow the instructions completely. They will cancel it, or they will have to repeat it at an earlier time, or the worst part, they might miss something.
Yeah.
The whole reason you're there is to catch things and have early detection and early intervention on these polyps that can become colon cancer. So you want to make sure that they can see absolutely everything that they need to see. My other recommendation about the prep itself, whenever you're going to the pharmacy and you're picking up the whatever bulk liquid that they're going to have you do, every GI doctor or colorectal surgeon or general surgeon's prep is a little bit different. If you're having to choose one and they have a flavor, generally they're a little salty-ish. So choose one that you don't mind, like a salty note in. For me, that's usually something lime flavored.
Yeah.
Like, I don't like lime at all. But if I'm going to have something salty, I'd rather have salty lime drink than salty berry drink.
Yeah,
like
for
that's
sure.
just me.
Yeah.
So that's my recommendation
Yes.
on flavors
Yes.
whenever you go to the pharmacy.
And my only other thing that I will add to that is please be honest with your colonoscopy person, whoever's doing it for you. If you feel like your prep wasn't sufficient, tell them right away so that they, like Brittany said, they don't waste their time going in there and then having an.
Well, not even waste their time. It's more about the patient.
The patient, that's what I'm saying. Like,
No,
so you don't.
the patient doesn't waste their time.
Yeah, the patient doesn't waste their time. Yes.
But you meant the doctor.
No,
I was
not
like,
the doctor. No, the
they
patient.
don't. Like they're
No,
there either
so that
way.
you, the patient, don't waste your time and get an unnecessary
sedation
procedure.
and all of
Sedation and
that. You don't want the
yeah.
risk of all
So
that.
just be honest and
Yeah.
let them know. And a lot of times they may say, you know what, no big deal. We'll figure it out or we'll be
Yeah.
okay.
So tip number 2.
Oh yeah.
I told you this tip.
Yeah, you did.
This
And
is clutch.
this honestly, it made it the best day of my entire life. This tip, I lived my best life.
Yeah.
Because you know what I did on the day of my colonoscopy prep?
Colonoscopy prep tip number 2 is
Be a bum.
be a lazy bum.
Literally, I did not get off the couch the entire day.
Except to go potty.
Except to go potty, yes. Except to go potty. And I watched TV the entire day.
Yeah.
Which I haven't done
Yeah.
since I was like it was
college.
college,
Yeah.
like Christmas break
Yeah.
or winter
Yeah.
break or whatever. Like I watched all the movies that I ever have wanted to watch for the past year and a half and I haven't had time to watch.
Yeah. So
Like,
this
it
is
was great.
tip colonoscopy prep tip number 2. When I told you this, I saw the relief come over your face.
Yes. Oh,
Do
yeah.
not try to be productive.
Yeah.
Do not try to get caught up
Nope.
on something.
Nope.
Do not try to do anything productive. You pick out 3 movies, you pick out 3 TV shows, you pick out a book or 2, and you sit your butt on the couch and let the day be what it is.
It honestly makes me look forward to my next trip. Like, ooh, in 5 years,
I get a lazy
I'm
bum
gonna go.
day.
Yeah, exactly.
Yeah. So that's our tip number 2. All right. Tip number 3, and this is another really important one that I don't think you would have realized
I wouldn't have.
if I wouldn't have told you.
Yeah.
And I do this because all my patients in the hospital were constantly all of them have tummy issues
Yeah.
in one way or another. For your prep, put it in the fridge. Make it ice cold. There is nothing worse than this stuff room temperature or a little warm.
Yeah. No, that's
So
accurate.
put it in the fridge. Make sure it is cold. I like to drink it with a straw because I think it just goes down quicker and easier. But you're going to want to put it in the fridge. Make sure that it is cold. and then kind of pace yourself. Like if you know that you have to drink half of the prep by 5 p.m., depending on when you're starting, just have your mental note of like, okay, I need to get through half of this class by this time. And it just helps pace things out a little bit better instead of feeling overwhelmed.
Yes.
By it.
And so when you're pouring this out into your cup, only pour out the amount that you're going to drink in that amount of time, in 10 minutes, 15 minutes, whatever it is. Don't pour yourself like the huge, like gallon-sized cups from wherever, and then it's going to be whatever. And be careful, too, if you're putting ice on this, don't let the ice melt because then you're going to have to drink more
liquid.
More liquid. So only pour out the amount that you're going to drink in that that little span of time there.
Yep.
All right. Number 3. Oh, no, that was number 3. Number 4. Oh, here we go again.
This is my most
This was
clutch.
Brittany. Like, again, it made my prep so much better because here's what I was doing before Brittany got involved in my prep. Here's what I was doing.
Can you say colonoscopy prep?
Colonoscopy prep, yes. Before my colonoscopy prep, before Brittany got involved in it, I was just trying to like choke this stuff down. I was drinking it, and then I was drinking a little bit of water, and then I was drinking a little bit more of that, and I was miserable. And Brittany comes in after, like, I think you'd been at work or something, and you come home and you're like, what are you doing? So tell them what you told me, because it'll save my life.
So you need to remember that a clear liquid is a clear liquid is a clear liquid. And what doesn't go down is also a clear liquid in theory. Again, I know this because I am a surgeon and I deal with people with tummy issues all the time. And when I make rounds, we talk about this. So one of the things that you can have all day to get the whatevers is gum. You can have gum all day long.
Yes.
However much you want of it, like get your favorite flavors and get 3 of them and whatever. The gum will help take your mind off of things.
Yes.
Number 2, this one's a really good one.
This was the good one.
Hard candy.
Oh, yes.
Hard candy will save your life when you are doing colonoscopy prep.
All of a sudden, with the hard candy, like I went from being pretty miserable to like, actually like, oh, like I'm having this hard candy. And then I was actually looking forward to drinking the prep. I was like, oh, like I'm going to drink the prep. And it's actually like, it was a nice combination.
Yeah.
I went with Werther's. Like the Werther's original hard candy.
You can choose whatever hard candy you want.
Butterscotch, you can do whatever it was.
Green Jolly Rancher.
Oh, yeah, Green Jolly Rancher.
Lifesavers. I mean, possibilities are endless.
Yes.
And get you several different kinds.
Yes.
Because you're going to want a little bit of an assortment. But so this is tip number 4, is that clears come in all shapes and sizes and forms. And I really think, you know, in addition to what we just talked about, that giving yourself some sort of like, I don't know, we're, as Americans, we're very like breakfast, lunch, and dinner and snack oriented. So in my mind, I kind of made that for myself. Like for breakfast, I'm going to have coffee. Now it can only be black coffee, but you can have coffee in the morning as a clear. It can either be hot, you could put it on ice. There's like you could have a hot black coffee and then an iced black coffee, like just to give your mind and your taste buds a little something to do.
Yeah.
For lunch, I had an iced tea.
Ooh.
Yeah.
Big spender.
Go, I know. Go to the fancy tea drive-through in town or the fancy whatever. Get yourself a hot tea or an iced tea. Maybe get both. And just have that to like look forward to a little bit later on. Or it could be juice. Like if that's your jam, like juice could be another clear liquid you could look forward to at lunch. Then snack. Hard candy and kind of all day long. The hard candy is clutch. I did the little root beer barrel hard candies.
Suckers.
Yeah. Oh, and suckers too. That's the other thing. Dum-dums. And you don't want something that you can chew and swallow.
Correct.
It needs to be something that you're just sucking on.
Yeah. You could do the bubble gum pops. The ones that have the gum in the middle of them.
Just don't chew
don't
and
chew
swallow.
it. You gotta suck it.
It's gotta just be licking and sucking.
Yeah. Edit.
Anyway, and then for dinner, I think it's good to do like a broth and a popsicle.
Yeah.
Right?
Yes. Broth and a popsicle.
So broth, like whether it's a bone broth or a chicken broth, I mean, there's no good way to like eat just straight broth, but I do think it at least gives you some protein back. and it gives you something a little bit different and salty
Yes.
to like put in your mouth.
Yes.
And the popsicles, again, make sure you're not doing red because it's going to look like blood.
Yeah.
If it's in your...
And none of the hard candy can be red either.
Yeah. Nothing can be red. And that'll be on your prep information. But a popsicle that is like, again, you have to make sure it's like the kind of clear liquid kind, like the fruity ones that don't have weird whatever.
Yeah.
But like a popsicle is a great way to get a clear liquid in a different form and like take your mind off of I'm not eating well.
And here's, I can already hear it now. I can already hear the people coming at us for like, oh, they're doctors and they're recommending all this sugar and dyes and all that. Hey, you know what?
You better believe it.
It's one day. It's like, it's going to be fine. Go for it. It's
if
one day of all this.
If you don't want to hear about the artificial dyes one day of your life,
I don't know who you are.
Move along. Don't listen to our
this thing
recommendations.
because
I'm just telling you how to make it better.
That's right. You can choose to not make it like this and do whatever you want to do.
Artificial dye-free popsicle. I don't know. Figure it out. But
dyes and the refined sugar for one day to make yourself get through this is way better than missing a colon cancer.
All right.
That's all I'm saying.
Tip number 5.
Okay, here's where again, scaredy cat right here. This is why I'm not a great patient because I get really scared of like what could be, what could happen. I am deathly afraid of throwing up. Like I will do anything not to throw up. And so I was really concerned that like, oh, when I take this prep, like it's going to really upset my stomach and it's going to make me throw up. And like Brittany was like, nope, like that's not a thing.
If you do it right, it's not a thing.
It's not a thing. Yep. And then the other thing is like, I was really concerned. Like I thought I was going to have to live on the toilet. I thought I was never going to be able to get up from the toilet because it was just going to be explosive. And that's not the case. I never once pooped my pants.
Yay! Save that.
Yes. I never once like had to like live on the toilet. I would. There were times when I was like, "Oh, it's time to go to the bathroom," and so I would stop my movie for like my 6th movie in a row, and like walk my butt to the toilet and do my business, and then come back. But it was fine. My stomach didn't hurt. Like I actually was like, it was not a horrible experience. Yeah.
And some people do have a horrible experience. I just think you really minimize the amount of horribleness and the amount of uncomfortableness whenever you split it up. Appropriately and give yourself time. And also, let's be honest, like take away that sympathetic and like innervation of like scared and whatever by watching movies and relaxing. And like I think that helps a lot. All right, tip number 6.
Also important. I mean, it's just another fantastic tip here.
I should write a book about this.
You should write a book. You have to, and this is another Brittany idea. She was like, okay, where are we going after your colonoscopy?
Once you wake up.
And I'm a huge breakfast person.
Yeah.
And so I was like, oh, we're going to this breakfast place here in South Carolina. It's like my favorite. We're going there.
My system's going to be clean. We're going to fill it all
and
up.
I'm going to eat everything. Like and I was listing off the things that I wanted to eat. And it was so nice to like that morning to wake up and feel like, oh yes, this is the morning I get to eat my breakfast, right? So have a special place that you can go. Have something to look forward to.
Yeah. All right.
So that's it. Those are our tips.
That is the way that you make your colonoscopy prep a little less insufferable.
Yes.
A little more tolerable and something that you actually might look forward to.
Maybe. I mean, I'm looking forward to my next one. It's the only time I'm allowed to sit on the couch all day. All right. So if you enjoyed this episode, please make sure you share it with everybody. We want everybody to hear this information. Remember, this is medical information, not advice. All the advice needs to come from your doctor. Please like and subscribe on wherever you listen to this podcast, whether it's on Apple Podcast or Spotify or on YouTube. And then, of course, come and listen to the rest of our Coffee Walk MDs where we talk all the things and cure your boring conversation. So I'm Dr. Brian Kendall.
Dr. Brittany Bankhead.
And this is Coffee Walk MD.